It is time now for Morning Rounds, and joining us this week are CBS News medical contributors Dr. Holly Phillips and Dr. David Agus.
First up, a report out this week says many more American children have autism than previously thought. The Centers for Disease Control says 1 in 68 have it. In 2012, the estimate was 1 in 88. That's a 30% increase in 2 years. Jim Axelrod looked into the new numbers.
The CDC says the findings don't mean more children are developing autism.
What number is this?
It means more cases are being discovered due to heightened awareness. Michael Rosenoff with the advocacy group Autism Speaks says this study looked at cases of 8-year-olds from 11 sites across the country.
The approach that the CDC uses is based on medical and service records. So that's why we believe that part of the increase in prevalence is due to better detection of autism. Better records and more records lead to higher prevalence.
The average age of diagnosis in the United States is 4.5. That's too late, say Lori and Kevin Troy in Franklin Square, New York. Their twin 11-year-olds, Michael and Kevin, were diagnosed at 20 months.
We were told 10 years ago that they would probably never speak, would never laugh or have friends or experience most of life.
Oh, you guys share the room?
Yeah.
How does that work out?
Not so very well.
And as for Kevin now what does your shirt say?
Who's awesome? I'm awesome.
Are you awesome?
Yes.
What was the key?
Before 2 years, they had 30 hours a week each of therapy in the house. It just opens a whole new world of possibilities for them.
So, Holly, I'm curious, why is it that these numbers, is it possible that we are just overdiagnosing autism?
That's such an important question to ask, really, because we know that cases of autism we're detecting much better and much earlier. But that doesn't mean we're overdiagnosing autism. And actually, for this study, the CDC looked very carefully at each case that they included and really made sure that each case met the standard definitions of autism or autism spectrum disorder. So they believe that each of these diagnoses is accurate.
I thought it was really interesting that boys are 4 times more likely to be diagnosed with autism as girls. Why do we think that is?
Well, I wish I knew the bottom line answer to that. What we do know is that boys may be more sensitive to specific genetic abnormalities that may be linked with autism. What those are and exactly how they behave, that's really an area of intense research right now.
Also this week, a smokers' rights group here in New York filed a legal challenge to the city's ban on electronic cigarettes in restaurants, parks, and many other public places. But the New York Times reported that accidental poisonings from the liquid nicotine in e-cigarettes are increasing all across the country. So, David, how are they increasing? What are the numbers like?
Last year, 300% increase from the year before in kids, predominantly. This year, it's probably going to be double what last year is. You could buy it over the internet. There's no child safety top. It's flavored with bubble gum and other things. And so kids are drinking it by mistake. It's dangerous.
Is this a particular danger for kids, David, do you think?
They can get very concentrated nicotine that can cause a lot of problems in kids and adults, by the way. And so there's no regulation. Canada, Europe, there's strict regulation. The U.S., we let them do what they want.
All right. There was good news this week about the number of people who get infections in hospitals. The CDC says there were about 722,000 hospital infections in 2011. Previous estimates had put the number as high as 1.7 million. Officials say some of the decline may be due to more procedures being performed outside of a hospital setting, as well as improvements in hospitals to control infections.
A new report from Washington University in St. Louis suggests that as many as half of all cases of breast cancer might be preventable. I couldn't believe this research, but It sounds like there are some lifestyle factors that come into play.
Yeah, it's really very, very important. And it's one of those things where we hear so much about breast cancer and we're all so fearful. But I actually find it very reassuring to know there are things that we can do to lower our risk. And the single most important is to exercise. The earlier you start, the better, but it's never too late to start. Also, focus on a plant-based diet. Fruits, vegetables, whole grains, less meat and dairy is actually a good thing, and lower fat foods. Control your weight. Make sure you're a healthy weight for as long as you can be, especially later in life. And try and have minimal alcohol.
I thought it was interesting also that they pinpointed this time between the first period and the pregnancy as being very important for a woman.
It is, and that's why these preventable factors, these things that we can do in our lifestyle to lower our breast cancer risk, the earlier earlier you start, the better.
David, there are some drugs available, aren't there, for high-risk women to prevent breast cancer, but some of these drugs are controversial. Tell us about that.
Well, I mean, to me, they're not really controversial. We can prevent breast cancer. They have side effects. You know, a baby aspirin prevents breast cancer, but also tamoxifen and raloxifene, 2 drugs that bind the estrogen receptor, have a dramatic decrease in breast cancer in normal and high-risk women.
So I guess what should a woman who thinks that she might be in that lower risk category, what's the conversation she should be having with her doctor?
Say, listen, what is my pretend chance of having breast cancer in my lifetime? What are the side effects and what is the benefit of taking a preventive strategy, and make the right decision for you? There is no one right answer. It's based on your value system and your personal risk.
It's hard to, I mean, but if you're an ordinary person, it's very hard to assess those risks, isn't it?
No, but that's why you talk to your doctor.
Right.
That's the role of the doctor, is to educate you and together make the right decision.
Okay. Finally, if you've ever wanted to compare apples to oranges, there's now an app for that. Google has created a search tool that gives side-by-side nutrition information for hundreds of foods. The company developed algorithms that not only compare foods in a single step, but also suggest recipes that use the ingredients searched. This is pretty cool, actually.
I love this. My favorite search is, of course, kale versus bacon. Yeah. If you want to make sure it works, you just look at those numbers and yeah.
You know, it's interesting, though, because when you really think about it, how you prepare the food also has a big impact on the nutritional value, and that's not something you can really Google just yet.
No, not quite. But still, that kale versus bacon, I mean, you could fry the kale. We're still close to those numbers.
Well, I know a lot of those searches are based on real searches that people actually did off of Google, so maybe the bacon and kale is even more frightening knowing that. Dr. Holly Phillips, Dr. David Agus, thank you both.
Thank you.